Hi, I'm Liz DeVos. I'm an emergency medicine physician at the University of Florida College of Medicine in Jacksonville. I have been the chair of the ASAP International section, as well as the ASAP Ambassador Program, and I'm currently on the board of the International Federation for Emergency Medicine. I was asked to talk to you today about creating a project in global EM. So a little bit about myself. I'm an emergency physician. I finished my residency here in Jacksonville back in 2006. After that, I did a global EM fellowship at George Washington University. While I was there, I participated in lots of other people's projects. I worked on developing projects related to teaching emergency physicians and community physicians who are not emergency medicine trained in several countries. We worked on disaster preparedness. We worked on basic emergency medicine skills, pre-hospital, and resuscitation skills. I also participated in some surveys looking at injury prevention, especially in orphanages in Ethiopia. I participated in curriculum development in India, in Turkey, and Africa. And throughout that time, I had the opportunity to work on lots of different projects, writing chapters, um, doing needs assessments, and we'll talk about a little bit of all of that today. All of this seemed kind of overwhelming to me when I was a resident. No one that I worked with was doing international medicine, and I was interested in a fellowship. And so I didn't have mentorship like all of you have in the faculty, in the programs where you're working, or through our national societies even. I found one faculty member who had done some global health work and decided I was going to create an international rotation for myself. And that was my residency global EM project, was learning the ins and outs of the ACGME requirements for a resident rotation and putting together the proposal so the dean would let me go abroad. Now I think there's a lot more resources for residents, and getting started on a project will be a lot easier if you consider not only who you know, but what interests you the most. So is your interest in research? Is it in education? Is it in disaster work? Is there something else? Then think about who you know at your medical school and the hospital where you're doing residency. Are there folks in your own department or maybe in a different field, but somewhat related in public health or community health or perhaps infectious disease or obstetrics or pediatrics that is doing the work that you're interested in? You can go further afield though. Our national and international specialty societies, many have resident and student sections that are great resources for both mentorship and thinking through projects, but also the international sections of all of these different organizations. So don't discount SAEM, IFEM, ASAP, AAEM, and others. Basically, I'd ask you to think about who you know and talk to your mentor before you go any further. You also really need to think about how much time you have. Let's be realistic. Many people's global emergency medicine projects are going to happen during their residency elective. A lot of us say we're going to start a project in our first or second year and carry it through all the way till graduation. I would love to hear how many people manage to do that. Some do, but the vast majority really spend their time on their dedicated elective month and that's it. So what does that really mean? If you're going to do a project de novo that requires IRB approval and get it published, you're going to need a lot more time. An IRB exempt project may be approved the same day, but most of the time it's going to take a couple of weeks, and then only if all of the paperwork is perfect from your international partner. And as we know, when we're working on projects abroad, things can take longer than anyone imagined. So definitely think through this, ask your mentor about the work they've done in the past, and set a realistic timeline. You'll also need time for networking, building your project with your local partners, and identifying all the people that you need on the ground to get the work done. And finally, getting something published. Just getting the work done of writing is tough, and obviously it's going to take time for it to go through the review process. So if you'd like to see a project all the way through from start to finish, I hope you're working on it throughout your entire residency. If not, maybe it makes sense to jump in on something someone else has already started so that you can carry on the work. I mentioned partners. Before you choose a partner or a project, you really need to think through what your international partners might want. Do you have to have an international partner? No, that's not the case at all. Certainly you could do a literature review or another individually motivated project where you're in charge of everything. That would be fantastic as well. But if not, you're probably going to need a partner, at least at your own institution and very likely abroad as well. When you're doing projects abroad, it's not ethical, as we heard in the last month presentation, to do projects that are on a population rather than with them. So you'll want to identify a local champion and understand what it is they're interested in and how the work that you're doing might be helpful. You might do a needs assessment as your entire project, identifying holes in the research or the data that's available currently so that that can be used for advocacy or for policy change. That's actually something that we did with some of the residents in my residency program in the last few years. We worked in a partner's pediatric emergency hospital to gather data about the kinds of traumas that were coming to the National Pediatric Hospital so that they could take that data to the government and lobby for a pediatric orthopedist at the pediatric hospital. Because the current situation was that patients with fractures were being referred to the trauma hospital where all of the orthopedists were. Unfortunately, it was on the other side of town, and with traffic and bus rides, this might be a 3-hour ride away. And by building a database, we were able to identify that most of the patients who presented to the National Pediatric Hospital for trauma actually had extremity fractures. They were successful in having an orthopedic surgeon stationed at their hospital. And we were able to identify things that their pediatric fellows and residents would like to work on, and together built a program with a curriculum for fracture identification, splinting and reductions, and together we're able to build that into their residency and fellowship training as well. So needs assessment all by itself could be a project. Sometimes though, it's just the very first piece of a bigger project. In that case, we need to identify who are the stakeholders, the people that benefit, the people that need to have inputs, build our research questions together with our partners, determine what the interventions will be, do the project, and keep monitoring and evaluating it. If you read through the resources that I have attached at the end, there's a lot more information about this type of project management in the EMRA book about international emergency medicine and public health teachings as well. Before you decide on a project, you also have to determine your resources. So I said at the beginning, you need to pick something that's interesting to you. You're not going to spend a month or a year or 3 years working on a project that isn't interesting, because really that's an investment of your time. and who has lots of spare time in residency. But also think about other resources. What are the resources of time related to your rotation or dedicated time for working on this project? Do you have to negotiate with the chiefs to get your schedule to align? Do you need to be independently wealthy to fund your travel? Or have you figured out another method for funding flights or seed money for the project? Did you think about other expenses? I did a fellowship project that involved a survey. It was a one-pager, and I thought, oh, in my emergency department, we just asked the person treating the patient to fill out the form. I went with my partner to deliver the forms and to make sure that everyone understood how it worked. And the first question they asked me was, how much am I going to pay the research assistants? What? Yeah, the expectation in that area was that each individual form that was filled out would be compensated, or I would hire a research assistant, no matter how simple the form was. This wasn't something I'd budgeted for, hadn't considered, and didn't have any good way to do. It was a setback for my project, and ultimately, I had to revamp the entire thing. So getting some realistic information about who can help you and what other kinds of resources you're going to need on the ground is also really important. You've also got to think about the IRB. Everyone knows you have to have IRB approval to do research. However, sometimes you can do quality assurance projects that don't require IRB reviews. But think about all of these things carefully with your mentor before you go forward. Getting IRB approval is the easiest way to be sure that your project can be published and that everyone is on board with it being ethical in the place where you're working. However, most IRBs are going to require IRB approval or an equivalent ethics board approval from the local community before you get full approval at your own institution. This can be a convoluted process. In some cases, it even costs money. In one country where I worked, every IRB approval was subject to a $2,000 fee. Even the local residents needed to pay this fee to have their projects reviewed. And so that was a setback for projects that didn't have big international funding. And of course, international projects may make something that would have otherwise been exempt, requiring expedited or even full board review. So plan extra time. You're also going to need city training if you're doing research. So make sure you leave yourself time to do this online course that has to be renewed every 3 years. If I had to give you one piece of advice, it would be to not bite off more than you can chew. Realistically, global emergency medicine projects are going to be finished during your elective rotation or in small parts in between on your lighter rotations for months ongoing. The last thing anyone wants is to have an overwhelming partway done project that never gets finished. You don't want it hanging over your head for your entire career. And it's really not fair if you're doing an international project to never complete it. So be realistic, plan and overplan and replan, talk with your mentor, talk with your local partners, and make sure that what you're doing makes sense. It's better to start with a small project and then build on it than to have an overwhelming project that can't be completed. So what are some things that you could actually do during residency? Analysis of an existing data set is a great place to start. This might be taking on publicly available information. So national public health data or international public health data could be summarized. You also could find a researcher at your institution who has a data set that you might be able to sub-analyze or help with a project that they're working on. Also think about things like our ACEP Ambassador Project. Our ambassador reports are collected from emergency medicine representatives throughout the world every 2 years. We're just starting on a new set of ambassador reports. And in the last version, we had several medical students and residents who participated in the analysis of the data and helped us to build the first worldwide summary on the state of emergency medicine. These types of projects will continue, and certainly there's opportunity for jumping on board and participating in these. Also, don't discount local underserved or health equity projects. Is there something in your own community that can be done that addresses some of the needs of global emergency medicine or global health or public health? Think about refugee populations, underserved populations, nonprofits, as well as projects within your own institution. You also might choose to take a small piece of an ongoing project. For example, I currently have a grant teaching pediatric EM ultrasound in Paraguay. I have residents and fellows who have developed a single lecture for a distance learning project. I've also had residents and fellows who've spent a whole month in Paraguay, and also have folks who are helping me build the curriculum and do the ongoing quality assurance for the program. This is something that has allowed opportunities for many residents to get involved. And I certainly have opportunities for Spanish-speaking folks to join me if there are any of you who would like to learn more about the project and would like to be involved. So my pediatric EM ultrasound project is actually also an example of a multidisciplinary project because I have pediatric fellows and residents, peds EM fellows and residents, ultrasound fellows, and EM residents working on it. But maybe there's something similar in your own institution, maybe infectious disease, surgery, OB, pediatrics, or more. May have a project that you could jump onto. And then some other ideas are writing up curriculum. So like I said, when I was working on building a global EM rotation, I learned all about the ACGME requirements and wrote up the process approval for a rotation and the whole curriculum for my rotation. And that's still in use today at our institution when a resident from any specialty wants to go abroad. We also had a resident who wrote up a new curriculum for a global EM rotation that didn't involve any travel. So her project was to complete global health lectures, a lot like the ones we're doing now, but also to spend some time participating in international teaching and then writing up how her rotation worked for someone else to model something similar. Simulation cases related to preparation for global EM have been the subject of many scholarly projects. There's actually a whole online program called Sugar Prep that resulted from the development of sim cases to prepare students and residents for work abroad. You should check it out. But also writing up cases. Did you see a really interesting case of something that is not commonly presenting to the United States? Like one of my residents wrote up identification of a botfly infestation with ultrasound in a clinic here in Florida. That would be a great case that would be not too difficult to write up. You could also consider something like writing an international book chapter. There's the International Emergency Medicine Project, IEM student, that's writing an international EM textbook that would have opportunities for book chapters, or things like the African Handbook on Emergency Medicine, or some of the other books that are linked at the end of my talk in resources, stemmed from resident projects with EMRA, like the International EM Guide from EMRA that was published, gosh, more than 10 years ago now. But these kinds of projects are great pieces of work for residents to take on. So here we go. As I mentioned, that blue book at the top, the International Emergency Medicine Guide for Clinicians in Resource Limited Settings, is written by residents for residents. All of those editors went on to global EM fellowships. And the book has some ideas about how to set up a rotation, has ideas about funding a rotation, has some basics of public health, and then some things like how to do a thick and thin smear for malaria if you were in a laboratory setting. The nuts and bolts of global EM was written by several folks who have also completed fellowships or had fellowships of their own, and published in 2016. This book at one time was available as a paperback book on Amazon. It might be still, but EMRA now has the rights, and the whole book is as a PDF on the EMRA website. This book has a whole chapter about projects and funding projects for global EM, but lots of other hints and tips if you're interested in global EM as a career. And then finally, if you have a project and you're trying to figure out how you're going to pay for it, a paper that I wrote with some other colleagues, focusing mostly on doing research in low and middle income countries, is here. But I think there's some pieces that would be also relevant for residents and fellows as far as considerations on how to write a proposal, and perhaps some places to look for funding. I can't emphasize enough, though, that places to look for funding should really focus on your own institution and your specialty society as options. But don't be afraid to be creative. Think about your Rotary Club. Doximity has some travel money sometimes. Think about other community organizations that might be willing to donate to a project for your particular population. And then if you're really interested in research as a career in global EM, think about the Fogarty Global Fellows Program. Check it out online. I can't emphasize enough, though, that whatever you choose, you have to work with your international partners to identify something that is going to meet the ethical needs of the community. And then let's think about, for a few minutes, decolonizing our projects. So we all want to gain information. We all want to gain a publication. But let's think about the population where the work is done, and assuring that we're also crediting everybody who works on the project. So be thoughtful about who is first and last author, to have those discussions up front and make sure everyone is on board, so that you don't lead to disappointment in the future. I gave you some ideas of projects that I've worked on, and I'm happy to discuss more. I can share my email afterwards, but again, it's elizabeth.devos, elizabeth.devos at jax.ufl.edu. I'm happy to engage in conversation and help anyone who has any questions about developing a timeline or a project. Don't hesitate to reach out. Good luck to all of you, and I'll look forward to getting to know more of you.